if you really delay your dental care and it's something that turns into something major, you get to be in my next book that comes out. Is this a shameless plug for my book? It is, but that's okay. That's what we're here for. Okay. But you become that next great story at the dental care group about this person. So you don't want to be the person that delays because, like I said, it could be something as simple as a little bite adjustment. And, nerves are very funny in teeth. There's something in tooth pain or nerve pain, I should say, that's known as like reversible and irreversible. And it's exactly what it sounds like. So we have something that's called a reversible pulpitis. A reversible pulpitis, without getting too technical, is an inflammation of the nerve of the tooth that can be reversed. If you wait too long, what's reversible can sometimes become irreversible. So if you go from reversible, it could be a little bite adjustment on your tooth. It literally takes less than a minute. If you wait too long and reversible, becomes irreversible, then you've taken a less than a minute tooth adjustment, virtually painless, and gone into a situation where you're probably going to need a root canal, then a crown, multiple visits, lots of money, and that's just by delaying care. If you have a gum problem, and it's a minor little gum problem, we can get out, maybe it's a visit to the hygienist to take care of it, and you put it off by delaying that minor little gum problem, and it turns into something significant. You go from having this tiny little situation where it could be just a hygiene visit to you're off to the periodontist, and it could result in gum surgery, tooth loss, an implant by putting things off. It's really funny. I mean, dentists are in a constant struggle with their patients and for various reasons. Sometimes it's trust, sometimes it's money, that we're trying to stress to people how important it is to take care of a situation. I had a patient this morning that I said to him, you need to get your teeth aligned. If you don't get your teeth aligned, your teeth are not going to last. You've been telling me about it forever. Well, I don't want to be right on this, because if I'm right on this, somewhere down the road, he's going to be faced with serious tooth problems and possibly losing one or multiple teeth. And what patients don't understand is they think we're trying to push treatment on them. And what we're trying to do is keep them healthy. And if every patient did everything we told them to do in this office, I mean, we have most of our patients do, but if every patient did, it would reduce the level of stress in the patients when it comes to dental care, which is most important. In the end, it's going to cost them less money because they're taking care of problems now and not waiting for them to get super huge. And it's going to lower their stress. And it's going to lower the stress of the office because we're going to be doing more pleasant, easy procedures on our patients as opposed to, sending them to our periodontists and our surgeons for major work because they didn't take care of what we asked them to take care of. So again, the name of the game is to take care of it early. If you don't take care of it early, it's kind of like that, Fram oil filter commercial. You can pay me now or you can pay me later. You can pay the doctor now or you can pay the doctor later. But when you pay them later, it's never cheaper. It's never less expensive. It's never less work. It's always something that's grown into something bigger, more involved, more treatment, more money, things that nobody wants. So take care of your mouth early. If the dentist tells you to take care of something, if you don't believe what they're telling you, that's huge because you have to trust your healthcare provider. But if you don't understand what they're telling you, have them explain it further. Let them show you where you're having gum recession and you might need to have a gum graft now so you don't lose your tooth later. Or if you have decay, let them show you where the decay is. If you're having deep decay, if you need to even have a root canal, let them explain to you why you need to have it so you understand it. But if you're told you need it, do it. And if you want a second opinion, go get a second opinion. The worst thing you can do, I should say, is ignore. Ignoring is only going to cause you problems later on.
Okay.
You did great. Your first podcast.